Again, my name is Randy Loss. I'm from the Office of Mental Health and Substance Abuse Services, and my role basically is I'm the Employment First lead for the agency, and this is a new position. It had not previously had an employment component to it. I'm sure many of you folks know the mental health services that are out there, managed care organizations, behavioral health managed care organizations, the county MH offices provide a lot of the services, and most of it, all of it, in fact, rather, is Medicaid funding, through Medicaid funding, and also through block grant funding at the county level. And just to get a little bit of sense of who's in the audience, just by show of hands, how many here are educators? Okay, we got a good number. How about, I know juvenile justice is here. Any VR folks? Okay, we got a couple VR folks. And anyone I missed? Oh, and what are you, Allison? Provider agency. Any other provider agencies here? Okay, good hand, good show. So just getting a sense of who the folks are in the audience. And I think it was a good bless you. I think it was a good connection that Ronnie had made about competitive integrated employment. And what I want to talk about is it is competitive integrated employment, but it's from the mental health side of the house. So, and I know that the reason I wanted to share this is this isn't something that's consistently done across the state, partly because of funding, but partly too because of there's not licensure. Many of the providers that we support in Office of Mental Health and Substance Abuse Services, the psych rehab service providers, they provide a lot of services, but they're in a bundled fashion. So for example, I'll talk later about ACT, the Assertive Community Treatment Team, and also FAP, which is the first episode psychosis teams that provide services to individuals. They do have a vocational and employment component, but it's bundled in. So it isn't like job coaching is $50 an hour. It's FEP or ACT services for whatever, and then they provide a whole host of services. So we don't have as good a detail of information as we might, as other partners within DHS might have, or OVR has. So I'm going to talk in general terms. And also too, I love questions. I want this to be as interactive as possible. But again, just a reminder, if you do raise your hand, I'm going to ask Ronnie to put on her track shoes and take the microphone over to you so that she can, she's tightening up her shoes, I heard her, so she can get the microphone to you. And can you hear me okay in the back? Am I loud enough? Good. I got the heads up. We are being filmed, so I told her I'd make sure to get my good side. But again, so evidence-based practice, supported employment, sorry. Just first, let's go over the objectives. Our objectives are, we're going to list the advantages of using evidence-based practice supported employment for individuals with serious mental illness, and I'll use the acronym SMI for that population. We're going to review various programs using evidence-based program supported employment, practice supported employment, and the benefits to the individuals with disabilities. And lastly, we'll summarize the benefits of this practice for long-term outcomes. Now, I'm sure many of you already know what Employment First is, correct? It became a law in 2018, and it was based on recommendations by Governor Wolf. And it's to help prepare young people with disabilities to become working adults, and also to help adults with disabilities to get and keep a job. So the more details of that are, hold on one second, just give me a moment here. I had my notes, but they're kind of jumbled up. Oh, here we are. Again, we want to help students transition from secondary education to adult life. We want to improve access to reliable transportation to get to and from work on time and every time. Now that, I think, is going to be the biggest challenge. I'm sure many of you folks agree that transportation is probably the biggest issue that we face, especially with students, especially those that don't drive, and those that are in rural settings. So that's a big nut that needs to be cracked in terms of how those individuals can get from their homes to their employment sites or their job shadowing sites or their internship sites. So that's something that has yet to be kind of cracked. Does anyone have any solutions that they're currently working on in regards to transportation that maybe you'd like to share? I kind of figured there weren't going to be many hands up, but it's something that I think really needs to be focused on. Because if you know, Allison, you have your hand up? Okay, hold on 1 second. Sorry about that.
Shameless plug, I am doing a session on time banking later on today. Transportation is something that can be managed through time banking initiatives throughout the state, and that we have been able to get people transportation to work as well as recreational activities.
Person of interest. Also, too, I'm meeting with the Bureau of Employment Programs, which is in OMAP, the Office of Medicaid Assistance Programs, and they have the SNAP program and they have the TANF program, and I'm finding out a lot of information about those programs. If individuals are signed up for those, it does pay for certain schooling, for tuition, it does pay for transportation. So again, if you're not familiar with those programs, I strongly suggest that you become familiar with those programs and see if your students and their families are participating in those programs, because transportation can be a funded service through these programs. So again, I didn't want to kind of go too far down that rabbit trail, but I think it's important we talk about transportation. Also, part of the state law of Employment First is leading by example, improving state contracts and reducing barriers to Commonwealth employment. I know currently, as part of the Employment First law, there is the Employment First Oversight Commission. Is anyone familiar with who that is? It's an organization, like for example, Steve Sorovic, Mary Hartley are involved in this, and they're looking at making recommendations to the Persons with Disabilities Commission about what are needs that need to be identified, what can state agencies, what can state departments do that are going to help persons with disabilities become more employable and have employment. So what they're talking about is how they can be a part of everything that any of us have in regards to the opportunities to go and work, having businesses aware of what are the needs of persons with disabilities, and it does make good business sense in this socially conscious day and age to hire persons with disabilities. So it's very important that this commission gets its report out and gets this information across state agencies and departments. And one of the really cool parts of this recommendations that they're making is they want to have persons with disabilities actually become like civil servants. So I think that would be really valuable if we get individuals in state agencies that are civil servants, not just interns, not just doing job shadowing, but actually having jobs as civil servants in state agencies. So to me, that's kind of exciting. And again, increasing public awareness, collecting and coordinating data. I just found out from this commission, to my shame, to my agency's shame, it's a criticism but not necessarily a bad thing. Of the 67 counties, 48 of the counties had employment go down for persons with mental illness. So I need to find out what the heck that all means, but that's an important alarm to me to say that we need to do a better job in terms of helping persons with mental illness get employment opportunities. So again, that's a very important thing. And also too, they're going to be establishing and monitoring accountability. So me being in this position, one of my roles is going to be, okay, developing good data and then being accountable for that data and finding out why things are not working well, what are the trends, what kind of technical assistance do I need to provide or national experts need to provide to be able to help individuals with mental illness to be able to be successful. Before I go on, any questions, any comments? Okay. I know this is first thing in the morning. If you need to get coffee, please feel free to go out there and get more coffee. So again, why focus on employment? Viewed as many as an essential part of recovery. I personally think that if a person's working, that's the highest sign that they're in a good place in a recovery. You know, that if they're working, if they're being successful, they have their social outlets, they have income, allows them to be independent, you know, not being dependent upon the system, to be able to just be in a good place mentally and in the recovery process. And again, statistics show, research study after research study show that persons with SMI want to work. Usually the data is between 69% and 75% of individuals with mental illness want to work. So they have the desire, they want to be able to work, they just need the opportunity to work. And again, a typical role for transition age students in this day and age of WIOA, and the update of IDEA, and Employment First as a law in the state. It's Our responsibility as professionals to provide as many vocational opportunities for students, despite their disability, to be able to have opportunities such as job shadowing, internships, apprenticeships, and even jobs, summer jobs, part-time jobs, whatever, to be able to be successful. Or, I think it's even more important for those individuals that maybe are in a poverty class to be able to have the opportunity to get post-secondary schooling. Because again, to help them get the higher incomes and get out of poverty, they have to have those degrees, they have to have those certifications, they have to have those skills the businesses are looking for and are champing at the bit to hire for. So I think it's very important that we help them do that. Again, it's a cost-based alternative, facility-based services. Again, I'll talk more about ACT and FEP later, but the reason they came about is because of hospitalization, partial hospitalization, are very expensive methods to help a person in their wellness. So it makes sense, it makes dollars and cents, and for the benefit of the individual to be out in the community. Much like what happened with individuals that are in the ID world that have been institutionalized, it's the same thing on the mental health side. It's helping individuals become institutionalized, and be successful in the community. And also, too, it gives a sense of purpose. Because if you think about it, what's the second question you ask a new person after you ask their name? What do you do? It's such an integral part of who we are, as part of our well-being, as part of who we are socially, because again, just like the rest of you, I like to develop my skills, but also be proud and have a body of work and say, this is what I do, and this is why I do it, because it's something that is of value to me. So we want to help individuals with mental illness have something of value to them in their job, in their income, and what they do. So again, benefits of being employed. I know I'm preaching to the choir here, but I think it's important we talk about this because sometimes we can forget these details or forget these foundational things when we're working with individuals. We're looking at the goal, at the end goal, getting a job, but we're not looking at what are the reasons, what are the foundations as to why it's important to that individual. So I think we need to make sure that we take time to talk about how important it is to the individual and make sure that they are on the same page as us, or vice versa, we're on the same page with them, I should say, because we want them to be leading their recovery and being able to help them look at the facets of why it's important to work. So again, increases income and quality of life, because again, if you're having a car that breaks down constantly because you're in a position that's very low paying, you want to work to get to a better job. So you have that better car, you have that better home, you have that better neighborhood to be able to improve your quality of life. Improve self-esteem and social networks. Again, as I walked in, I know Ronnie, I know Allison, Linda Zale was here earlier, the folks from BJJS and OVR are here. It helps me to know who they are as a professional because it helps me to grow as a professional myself, and hopefully I can give out to them and help them grow as professionals. Better control of symptoms. Again, if you're working, you're consistently going to work. My oldest son just got his first professional job last week. He's learning about getting up at 5:30 every day. So I think it's important if we have those routines, it helps reduce symptoms because if you have something to look forward to, you're not focusing on your mental illness. It reduces use of illicit substances and use of mental health services. Again, if an individual has purpose, has something of value in their life, they're going to use that as opposed to turning to their old ways or their patterns of thought to continue down the lack of recovery. So again, I think it's important that we talk about this stuff and we package it in regards to, well, this is a benefit of employment. It's not just getting a job. It's not just being able to come out of poverty, but there's a lot of other benefits as well. Now, the effects of unemployment, again, not enough money, health issues, economic issues, social issues. And I think it's important we talk about this for even a little bit more because, and I'm going to look at my paper here so I can share some statistics. Unemployment costs the entire country about 2/3 of the $444 billion dollars that are spent on mental illness services in USA comes from lost earnings and disability payments. 40% total have a mental illness. So the negative effects far outweigh the positive effects when it comes to the impact of unemployment on society and the individual. Again, not enough money. Again, poverty. And actually, our Secretary Teresa Miller of DHS, met with OMSAW's staff about 5 weeks ago. And one of the first things that came out of her mouth was, we want to help individuals with mental illness not just get jobs, because a minimum wage job can keep them in poverty. And I when it was my turn to speak, I said, I can't agree with you more. And I think that supported education is something that's just as important as supported employment. And what I mean by that is, for individuals with mental illness, sometimes the education route can take 6 to 10 years, maybe 15 years. So it might be a very long time for individuals. So I say that what my agency needs to do is look at providing more supported employment, or supported education opportunities, so that individuals with mental illness are thinking about college, or thinking about post-secondary education, so that, again, they get those better paying jobs, they get the skills that businesses are looking for, and they're able to be successful in life. Not that they're not successful if they hold a job at a lower rate, but again, it's keeping them in poverty. So I think that using tools that are meeting the individual where they're at, as opposed to saying, well, here's what we have, I think we need to say, no, what's working for individuals, what's working nationally for individuals, what's working based on evidence, and let's implement those things so that individuals with disabilities, individuals with mental illness in this case, are able to be successful. Because to me, that's the most important thing. Because at the end of the day, I don't want to just say, hey, I helped the person move one step, but can I help them move 2, 3, 4, a half dozen steps? I think that that's what we need to ask ourselves, is how can we move a half dozen steps as opposed to just one step? So I think that that's an important thing we need to ask ourselves as professionals as well. Again, health issues. Statistically, I've heard anywhere between 15 and 25 years, a person's lifespan is lessened by serious mental illness if it's not attended to, serious mental illness. So I think that's a clarion call in regards to, are we helping individuals really get better? Are we helping them just exist? What are we helping these individuals do? And I think employment, I think supported employment, I think supported education are valuable, invaluable tools that help individuals with mental illness not only become successful, but live quality lives and even live longer lives. Because to me, that's just a very disheartening fact that a person with serious mental illness might not be here. I might live to 70 years old, and they might only live to, 50. I mean, that just really blows my mind when you think about that. So, what are we doing to help these individuals, help themselves, help them in their process of recovery? So I think it's bringing the right tools that meet them where that makes the most important value. And economic issues, again, during unemployment, there's no income. I mean, they might have welfare benefits and whatnot, but again, that's just eking out a living. I remember my college days living on $15 a week with macaroni and cheese and hot dogs. And I remember one day I just ate 3 candy bars, went to main campus, just ate 3 candy bars, and that was my lunch for the day. But then again, that wasn't my situation forever. But as a poverty college student, it was then. So how do we help individuals come past that experience? What are we doing to help them help themselves, but also provide the services and supports that meet them where they're at? So I think that that's a very important thing we need to think about too. So, and the reason I'm saying this is just helping you set the stage in terms of why evidence-based practice supported employment is an important tool for persons with mental illness. And I really liked an article I just read. Sorry, can you hear me okay? Okay. I really like an article I just read that I used to pull these bullets out from. I think it's very important that we, in this day of being socially conscious, we talk about that and we practice it, because I think it's a social responsibility, a right and freedom to gain access to, not freedom from employment. So again, going back to what I said a few minutes earlier, what are we talking about to the individuals we serve? Are we talking about restricting, trying to reduce risk for the system? We're trying to increase the opportunities for individuals to put themselves out there. Now, when I was a supports coordinator many years ago, I won't say how many years ago, but there was an individual who was in a recycling plant, and his mother had just passed away. He was now living with his sister. It was a new environment. It was a new situation for both of them. And he said adamantly, I want to get out of there. I want to have my house on my own. So I worked as a supports coordinator to help him find his house on his own. Again, regulations and rules and stuff like that weren't as strict as they were today, but I supervised the situation very closely, and I found a landlord that was willing to allow him to rent close to where his sister was. He went and lived there, and it worked for about a week. But I needed to have that opportunity for both myself to say, what do I need to do to support an individual, but also for him to find out that, hey, maybe living on your own isn't that great. You know, maybe there are some responsibilities that you need to take and have to take. But I think it was a great experiment for both of us. And luckily, the landlord, she was a kind person. She said, I'm not going to charge him any rent. So again, you know, this is a really neat opportunity to try to help this individual learn about themselves. So I think that we as providers, there are many rules, many regulations, I understand that, but what can we do to help the individual kind of stretch their experience, stretch their risk, you know, so they can try something themselves. You know, because again, I can see myself with my sons trying to restrict their risk because I know where they're going. They don't know where they're going, and they don't think I know where they're going. But I need to make sure that I back off to the degree I am able to be able to offer risk. So again, what are we allowing individuals to do in terms of having that risk? Yes, it might be chancy, might not turn out well, but I think to help the individuals be individuals, we need to allow them to have dignity of risk. So again, the second one, a challenge. So go home today or after the end of the conference and say to your loved ones, I'm not going to work anymore. And see how well that goes. You know, I think that, are we telling individuals, are we counseling them, not necessarily in what we say, but how we say it? Are we putting them off in regards to trying to have experience and try to move towards employment? Are they trying to stay in a safe place in employment, you know, or in their world, trying to save their benefits and preserve their benefits, which is understandable, but where are they going to be in a better place? So they're going to be in a better place if they have a full-time job with benefits, or staying in poverty, excuse me, with their welfare benefits. So again, we need to ask them that, because just try and put yourself in their place. And access to employment in the United States is both a right and responsibility. I think that if we're asking people, do you have a question?
Yeah,
hold on,
I was just waiting for your
mic.
thought. She gave me the mic.
Okay, cool.
Can I go?
No, go ahead.
All right, sorry. I'm sorry. My name is Jim. I'm the transition coordinator for a district about 2.5 hours northeast of here.
Sure.
And we're talking about that dignity of risk. And my concern is, as the transition coordinator, I've been to a million different IEP meetings. And with this population specifically, we see a lot of times where the parents will not allow. Okay, all right, perfect. It's not just me. Thank you. So the parents will not allow it. Where do we go from there? Because they're concerned that they're going to lose the Social Security. I've heard every excuse in the book that they will not allow their children to go on.
That's a real challenge, yeah.
And I can see that everybody else is, so that's.
I'll be honest. I'll be a little open myself. My son is dating a girl who's 17. He just graduated. He's going to be 18 on Friday. Dating a girl whose family, their income is welfare benefits. The mother doesn't want the daughter to work. The daughter has no disability. She wants to work, and she's extremely frustrated because she wants to work. She wants everything we're talking about, that independence, that income, the social network, but she's not being permitted to do that. So it's not an easy thing. And I don't mean to not have an answer, but it is a challenge. And that's one of the things I've been scratching my head about. It's like, well, how do you address that? Because again, until the person is legally an adult, you have many
My major
voices.
concern, I'm sorry to cut you off there, but my major concern is this SMI population.
Right.
Where we see it the most,
Right.
the most prevalent. I don't know if everybody else can kind of agree. But they're just absolutely afraid because it took so many hoops to jump through and hurdles to jump over to go ahead and get them on that SSI as early as possible. And now they're not losing it.
Right.
It's attached to the hip and they don't want to get rid of it.
Well, and that's one of those things where, I have to kind of take it into my my thinking cap, because again, I know when I was working with VR, I had worked for OVR for 16 years. So one of the challenges that VR counselors were facing with persons with mental illness was not the individual themselves and what they want to do, but the system itself. And I think that because people become very dependent on the system,
Correct.
until the system changes, that dependency won't change. So my thought is, as best possible, I see a hand raising over here slowly, so a brave soul wants to share. But I don't have an answer, and I'll be straightforward in that. But my thinking is, I like to try and look at, take back what people are telling me. And that's why I want it to be interactive, to say, well, what do we need to change about the system so that that dependency, that nagging dependency,
Correct.
isn't a stumbling block? Because what I was about to say in regards to working with VR was, I'd talk to the counseling staff and they'd say, well, we want to help this person with mental illness, but we're afraid that we'll get them the job, they'll start the job, we'll close the case, they'll lose the job. Because currently, OMSOS does not provide long-term supports. So I've been thinking about that for many years, and I think one of the solutions is vocational peers, so taking certified peer specialists and training them to become vocational peers. And I think that can be a long-term support that's going to help the individual to keep the job.
Correct.
So again, it's one of those things where I'm hearing this relatively recently, and I need to take in my mind or into my paradigm, well, what is working? What can work? Because this is something that is national. It's not just here in Pennsylvania, but it's national because it's a national program.
Sure.
But until that changes, I think you're going to have those challenges. And again, my personal experience, I know what you're talking about personally, because it's really frustrating because
Sure.
this young lady has a lot of potential.
Oh, absolutely.
But it's being,
that's the frustration.
I think it's being robbed from her,
Yeah.
because she can't use it. Yes, you were going to say something?
Not really
Just
fond
to
of
poke yourself
this.
in the eye.
Yeah. So to respond to something that I've done with some of the students that I work with, mostly dually diagnosed, not. So we have, and I think this is a statewide thing, but WIPA benefit counseling, where they come in and kind of talk about, listen, this is how much money you can make while working with SSI. And then sometimes it works, sometimes it doesn't. But then parents can see, like, oh, it's not going to go away completely, or it's not going to go away like fast either. It's not like, oh, you start working and then boom, my SSI check is done. And I think that, easing their mind a little bit about how quickly it happens or not helps. But for some of them,
Yeah.
it's never gonna. Yeah.
Well, and did you have your hand up as well, or? No, I think there's a hand in the back, though. Kimberly has her hand up. And I will kind of address that in terms of the evidence-based practice model of supported employment. What she talked about kind of leads into that, but I won't go into that too much right now. But I think it might lead towards some solution in regards to the situation, because I think traditional supported employment, as it's offered now, is missing certain components. And that's what I'm going to be talking about, is how this model has a lot more components in it, and it puts the person in a much better place and a readiness for employment as opposed to your traditional based supported employment. Yes, Kimberly.
So there's is it BPQY, I think is the report, and I know they do that for adults. I don't know if they do it for sure with students, but I know as an adult that you can request that report, and that will tell you like what all they've made and all the quarters that they've paid in. But yes, the WIPA, that was going to be my suggestion, is the WIPA benefits counseling, because they will walk them through and show them, what they can earn and when they're going to lose their benefits, and if you're making this much money, this is how much it's going to be deducted, and exactly what point would you fully lose your check. So it's an awesome service that they do. The other thing that I would suggest for the students is there's actually a student status that they can be put in, so they can actually earn wages and it not be counted against them. But a lot of people don't know about that, and if you don't know about it, a lot of times they won't just put you in that category. Just like there's also, oh my God, I'm drawing a blank, the MAWD, Medical Assistance for Workers with Disabilities. You can go to work, they'll take you off your benefits. You almost have to tell them how to do their job and tell them, I need to be in this category, because they'll just take you off your benefits, and technically you can have your benefits, you just may have to pay a little portion. Yeah. So, just FYI.
Appreciate that.
Pardon me, the computer's saying the battery is low, so I'm trying to figure out what's going on here.
Oh, thank you. Hey, you don't want it. Nobody wants to talk in the mic. It's funny.
But I think, too, what Jim had brought up was very important, that if you don't do benefit counseling at the front, or if it's not a part of what you're doing, my suggestion is you probably shouldn't be doing it, because unless that foundation is developed for the individual in terms of what they're currently making through welfare benefits, what their family's making, and what they could be making, if that's not there, and how that translates into what is in the person's best interest, if that's not part of the conversation, I would say stop until you can do that as your foundation.
Yes, we have OVR.
That was all planned. So individual placement and support, IPS, that is the national model for evidence-based practice, supported employment. And it was something that was developed by Dartmouth University up in New Hampshire back in the mid-90s. They said, we need to look at a different way of providing supported employment services, because it was probably 10, 15 years old by that time, the traditional supported employment. And the folks that are Dartmouth were doing research. They received a Johnson & Johnson grant, so a private industry grant of $1 million to start the program. And they were looking at, well, traditional supported employment doesn't seem to be working with persons with mental illness. Is there a different way of providing services, supported employment services for persons with mental illness, to increase their outcomes? Success of getting jobs and staying in their jobs. So Dartmouth University did their research and developed what's called the IPS model, individual placement and support. And what makes it different from your traditional job coaching, and I keep saying traditional job coaching, like stuff that like ODP would be paying for, Office of Development Programs, currently what OVR pays for, the Office of Vocational Rehabilitation, is the current model is trained and place. And so do assessments, do more assessments possibly if needed, put them in job shadowing, put them in apprenticeships, put them in something to see what their job readiness is. And then when it's been determined by the professional team that the individual's job ready, then help them find a job. Now, the IPS model is place then train. And they found that placing individuals that are saying, hey, we want to work, you got to strike when the iron is hot. For persons with mental illness, if they're saying they want to work, they're ready to go, you need to strike while the iron is hot. And they found that the success rate doubled, almost tripled. I think it went from like 22% to like 66% of people getting jobs through the IPS model of supported employment. Now, I know, again, there may be some folks out there saying, hey, and I'm sure that Kimberly from OVR is probably thinking this, the counselor in the back from OVR, the staff from OVR in the back is probably thinking this, well, we don't want to burn bridges with the businesses. We don't want to use these positions for individuals with mental illness as sacrificial positions. And what I mean by that is you're burning opportunities for individuals so that they can get experience out in the real world with businesses, and you're burning the businesses because you're doing that. Well, they sent me, so-and-so, and they didn't work, so I'm not going to go back to OVR. But I say this, Nowadays, businesses are, many businesses are churning through teenagers, churning through a lot of folks because of social media, kids looking on their phone, not paying attention to what they're supposed to do. So businesses are already doing that. So I say that if you have the IPS model of supported employment in place, and you have the team, the host of folks, and you'll see a few slides later what I mean by that, in place, you're going to see success. The businesses are going to be happy with what you're providing them, and they're going to know how the model works. So where is it used? Basically, anywhere that there are jobs, wherever the individual says that they want to have the job. Instead of maybe having some jobs in your back pocket, I'm looking at you, Allison, maybe have some jobs in the back pocket, say, hey, maybe this will work for this individual. You have to listen to what the individual is saying. They say, hey, I want a job doing this, this, and this. You have to find a job that they want because you're matching up their interest to the type of job that they want to do. So, and again, I'm not dinging you or dissing you, Allison, in what you're providing, but based on evidence, based on research, finding jobs that the individual says, this is the kind of job I want, the team seeks that job. And again, getting back to what I was talking about in terms of the place then train, the person says they want a job, you try and get them a job within 30 days. I mean, it's very quick. And again, by following that recipe of success, the IPS model, it gets you the success you need for the individuals. And who benefits from its use? Obviously, the individual with a disability. Again, they're getting into a job, they're getting an income, they're getting a sense of helping restore their sense of self-worth in the job quickly. Also businesses, because you're matching the individual up with their interests and what they're saying they want to do. Bless you. And why do I care? As a professional, I think it's important you want to look at this model is successful for a variety of reasons for this particular population. So I think you want to care because if you're serving multiple populations, one size does not fit all. So your traditional kind of job coaching is not as successful for persons with mental illness. So while those services are currently being offered as the kind of service of the land, as it were, in Pennsylvania, I think we want to care because we want to have services that are going to work for our individuals, that are going to help them be successful and increase their success. Again, nothing against OVR in regards to, or ODP, or if ODP is in a room. It's just those models work for certain populations, certain disability populations. This model works, is shown to be the most successful model for persons with mental illness. Now, before I go on, does anyone have any questions? Okay, hold on a second. Sorry.
Within hours too, students benefit as well as the school district with the graduation rate because we actually offer credits for students that are out working.
Okay.
So rather than the time that they would be in school, they get those 3 credits or 2 credits depending on the length of time that they're working during the school day.
Okay.
So with just an added benefit.
So there's something that can, I mean, if the kids are really concerned about being successful in school and making that connection to the world of work, that's a good entry point.
Yeah.
for
Well,
what you're
a lot of times our students, they're not worried about the science, they're not worried about the chemistry, but all of those different kind of electives. So we will have them going into work, based on their interest, that kind of thing.
Sure.
But then, where these students would have dropped out if they didn't have this job.
Right.
Does that make sense?
Yes,
So
yes,
it's that, it's
something for them to
keeping
look
them,
for.
exactly,
Yeah,
it's
something.
keeping them interested and keeping them there.
And you very well may have elements, the different school districts here, you may, and even the service providers may very well have elements of this model, but I'll talk about a fidelity scale that exists, that you need to keep that fidelity in place for it to be successful consistently. So you probably have some elements that are already going on. And the reason I have the IPS Employment Center listed here is I mentioned a few moments ago that Dartmouth University started this model, did the research for this model, and then basically the model kind of took off and it kind of started its own center. Now it's still up in New Hampshire in the same offices right next to Dartmouth, but they're their own standalone organization. And I was just talking with them yesterday. They have 24 states that are IPS model followers and six countries rather that are doing IPS. And I'm looking at getting into the community of practice to find out about how Pennsylvania could enter into providing IPS services for individuals with mental illness. Because again, I think that as our services evolve, again, resources are limited. I realize that. But I think as services evolve and as OMSOS, for example, is able to step into doing employment, how can we partner together to make sure that our common individual, those with mental illness, are being successful? And I think from what I can see, my research is telling me, and from what evidence is showing, this is probably the best model of supported employment for a person with mental illness. So again, would love, if schools want to come up and say, Randy, how can we partner? We'd love to be able to talk about that. Counties, how can we partner? Love to be able to talk about that. What I'm hoping to do is how mental health works is vastly different, I've found, than OVR, even vastly different from ODP. A lot of counties get what are called reinvestment dollars. Like there's block grant funds that are issued out to all the counties, and if there's money that is saved by the counties from those block grant funds, they can use them for reinvestment dollars. So what I'm hoping to do is talk to some progressive counties and say, hey, could we look at doing pilots of this model in your county and being able to do IPS and see how successful it is, follow the fidelity model of IPS Employment Center, and show the efficacy of getting better outcomes for individuals with mental illness. So that's kind of where I'm at right now. So this is kind of planning stage.
Now, have you reached out, just out of curiosity, because I did a Educators in the Workforce last year.
Okay.
And I was just curious, like our Career Link handles a lot of those funds,
Right.
where if the money is, that kind of thing, I don't.
Well, just a quick side note. What I'm hoping to do is now, and again, this is no diss on OVR. It really isn't. As folks probably know, they closed all categories.
Yeah.
So I'm looking at working with managed care organizations, looking at working with workforce investment boards to see if they could become employment networks. Mm-hmm. And are folks familiar with Ticket to Work?
Yeah.
The Social Security program? Well, basically, individuals with disabilities, if they're receiving Social Security benefits, they can get a ticket. And Kimberly, or OVR counselor in the back, if I go off the ranch on this, please bring me back on. But basically, individuals with Social Security benefits can get issued a ticket from Social Security Administration to help them get employment supports to be able to go to work. So most cases, many individuals give their ticket to OVR. Is that correct, Kimberly? And so the ticket gets issued to OVR, and if the person is successfully employed for, is it 9 months? What's the length of time that they have to be successfully employed? For VR to get the money back from Social Security Administration. What's the length of time that they have to be successfully, gainfully?
We only leave the case open for 90 days.
Okay.
But I don't know at what point that
Okay.
they have to be still open for it.
Okay.
Cancel the ticket for.
Gotcha. But basically how the ticket works is if the person reaches SGA for a certain period of time, I don't know what the time is, substantial gainful activity, that's a real tongue twister, and the employment network can show, hey, we provided X number of dollars, so we'll say $100,000 for this individual in these categories to be able to help this person become successfully employed. If everything falls into place as it's supposed to, the Social Security Administration will reimburse that money. So any money that these organizations put out, if the person meets certain criteria and the right categories of funding were provided, those organizations, employment networks, can get reimbursed. So I'm looking at workforce boards, I'm looking
That's
at
huge.
managed care organizations, because a lot of organizations such as community providers like job coaching agencies, whatnot, the heads and Goodwills of the world, don't have as deep of pockets as these organizations do. And I think that was something that was kind of a stumbling block, because you have to put that cash outlay out there before you get reimbursed. And that's why I'm ponying up to managed care organizations. I'm talking to workforce investment boards, because they do have those deep pockets to be able to put that money up front in hopes that they can get that money back. So I'm hoping that, I don't want to replace OVR, but I'm hoping that there can be an alternative system when situations like this occur. So I'm hoping that we can help individuals, get those services, when they're looking to have those services provided. So again, that was an aside. Sorry about that. But before I move on, any questions about the IPS model of supported employment? And actually, the IPS model is being shown to be effective in many different populations. Again, it was first used for those with mental illness and substance use, but they're finding that this is a great tool, this is a great service for persons with post-traumatic stress disorder, first episode psychosis, older adults, maybe people that have been out of the workforce for a while, and they need those supports to be able to get back into the world of work. Individuals are homeless. Again, a few slides from now, you'll see the circle of supports that are provided for individuals. And for those that are homeless, they need a lot of supports. They need a lot of supports in regards to being successful. And those with criminal justice histories. Again, you'll find, as you probably know, a lot of the individuals with criminal justice history are those with mental illness, those with substance use, and we're finding too, as Marianne can tell us from juvenile justice, there's a lot of trauma that's happening for these individuals. I think it's 9 out of 10 individuals that have been in institutions have some level of trauma. So it's just a high incidence. So there's some realities there in regards to, and again, these services are very 360, shall we say. And I think that's why it's important that we look at trying to offer these services. And I won't lie to you, they are more expensive, but I think there are models out there that can use to help contain costs, where it's a shared thing as opposed to you're going to pay all of this, but there's partners that are sharing costs. And again, as I mentioned a few slides ago, in regards to open to anyone who wants to work. So a person comes into a PRS provider, a psych rehabilitation services provider, and says, hey, I want to work. Well, let's find that person a job. Let's work with that individual. And even in some cases, I don't think it's in Pennsylvania, but I think some states have even gone to the point where even a person is actively using substances and has a mental illness, they can get into these services. So it is a bit radical in terms of when a person's, what we perceive as readiness versus the person's readiness. So there are some methods, or models rather, out there where the individual can be actively using. But again, the services are there, the supports are there, the mental health services are in place alongside of the vocational services to help that individual be successful, and the substance abuse services, excuse me. And again, as it mentions here, doesn't matter diagnosis, doesn't matter recentness of hospitalization, criminal justice work history, or work readiness criteria. Again, it's going back to focusing on what the individual says they want. If the individual says they want to work, we want to strike while the iron is hot. Because again, persons with mental illness, they're if they know that that's what they want, we need to respect them in that area and follow up on that and move forward with that. Now, this sounds controversial. Does anyone see any potential challenges in going down this road with population with serious mental illness? Sorry. Thank you, Ron.
Oh, I can't go that way.
Hello, my name's Loretta. Randy,
Yes.
one of the challenges that I have found in working with mental health population is that in most cases, in my opinion, folks are being heavily medicated, and despite their words saying, I want to do this, they physically and mentally are incapable of it. How does one address those issues?
Well, I'm very glad you asked that, because one of the things that I had spoken to in regards to, go back to a slide a moment. Back a slide, rather, 2 slides. The national expert from the IPS Employment Center said you have to have VR involved. And for that very reason, you need to have that vocational counseling expertise to say, well, let's look at the big picture. Yeah, the employment supports are in place, the mental health supports are in place, but what is the person's capability of working? So because of their medication, can they only work half a day? Or, you know, is their medication keep them up all night so that working at night would be a better solution for them? So those are questions that the team has to be aware of. So I agree with you.
Okay,
It isn't just a, hey, this sounds like a great idea, let's just do it. No, there are some, you know, we have to have the professionals come together so that we paint a picture that is appropriate for the needs of the individual, addresses the realities that they're living in, you know, despite what they might say. So again, there's some realities that they might be facing, like you said, because of medication. And it might be reviewed that, hey, this person is being overly medicated. Let's get them, you know, titrate them down so that, you know, they're in a better place. So that might be something that could hold up.
Okay, which would bring me to my next question.
Sure.
As support staff, whose responsibility is it? I mean, I fill out reports and send them on and have clearly indicated that I felt this individual's medication was a stumbling block for their possible employment. And then the ball was out of my hands. I felt, looking back on the situation, I don't feel that the individual that I was being asked to help had actually gotten any help. So is that falling through the cracks? What do we do as a team to shore up those cracks?
Well, and that's where, getting back to what I was talking about a few moments ago, and the IPS model talks about, there is a fidelity scale, and there's 25 points that you're supposed to follow. And part of the team makeup is there's a clinician, there's a psychologist or psychiatrist that's part of the team, and every team member is talking with a psychologist, psychiatrist, and they're interacting on a regular basis. So it isn't something that, you know, it goes off and disappears, but it's a team, it's a tight-knit team, and they have possibly up to like 100 individuals for that team that they're serving, but the team is interacting and talking with one another, and each person's input is as valuable as the next person's input in this the IPS team. So that's why it can be a more expensive model, but it's better to the needs of the individual because the team members are talking with one another and they're in tune with one another in terms of, if you say you feel there's a concern medically or psychologically because of the medications, clinician is right there saying, and the team is meeting and talking on a weekly basis to be able to address those types of issues.
Okay, where is this team?
Well, I'll talk about some examples of teams that are currently in Pennsylvania. But yeah, I mean, it's like, you know, just like OVR, I think that this is kind of a best kept secret. A lot of people don't know about these programs and the value that these programs bring to the lives of the individuals that are being served by these programs.
Yes.
But I'll get to that.
Okay.
Did you have another question?
No, I want
Okay.
to end this off.
Okay.
Nobody likes a mic. It's not funny.
It's a hot potato. We should make it look like a potato. Well, if it looked like a donut, no one would want to let go of it. All right, so again, as I mentioned a few times before, rapid job search, place, and train. The IPS Specialist, part of the team, help people start looking for jobs within a month of starting the program. Pre-employment assessment, training, and counseling are not required and are kept to a minimum. So again, that probably grates against some people in regards to the way things have been traditionally done. But again, it's looking at the needs of the individual and focusing on their interests. You know, I think to me, that's kind of a pinnacle component. And the IPS specialists help people explore the world of work at a pace that is right for them. So again, it's not saying, hey, I have this job for you, but the person might say, well, you know, it's like car shopping or looking for a house. You know, you're helping them find the right house or find the right car, but they might not see it right away, you know. So again, it's really person-centered planning. That's really what it is. And here's the model I was talking about. So let me take the mic so I can kind of talk through it here. So again, you have the medication and primary care team member at the top. You have psychotherapy on the 2 o'clock side. Family education and support at 5 o'clock. Supported employment and education at 8 o'clock. Case management at 10 o'clock. And then the individuals in the middle. So again, it's a very intensive program. There's a lot of professionals that are involved in it. But most models that are across the country are a combination of funding from mental health, from VR, from counties, possibly from school systems. So it's, I think Project Search is probably the best example I can think of in regards to how it's a shared thing. I mean, obviously it's not like Project Search because the dynamics are different, but in regards to making it work and making the funding be available as a shared thing, it brings all these domains into the person's life. It's almost like a wrap. If you're familiar with what wrap is for mental health, it's like a wrap for employment. You know, it's looking at the 360 of the individual and making sure that there's no missing components. And again, it's shown the efficacy of it is almost 3 times as better than traditional supported employment. But again, there's more cost involved. So that's part of the issue, part of the concern why it might not be in many places, why you might not be hearing about it. So. And again, who delivers it? The service is provided by a supported employment team. I just showed you the diagram that operate within community mental health agencies. So again, there has to be a mental health component. There has to be clinicians. There has to be psychologists, psychiatrists that are attached to it. It's almost like the certified peer specialist service, you know, where the psychologist, there has to be a team member that's a psychologist, psychiatrist that signs off on what the certified peer is doing. So again, that's what makes it different from your traditional supported employment. The mental health component is infused in everything that's done, including the supported employment services directly. Again, preferences of the individual are central. And again, I know this sounds like burning bridges or burning employers or sacrificial jobs, but I think because of the economy right now, the way businesses are scrambling for people, I think you're going to find a much better business atmosphere if we want to introduce this type of service now consistently across Pennsylvania, so that finding the right job is the most important thing. Because again, when I was with VR, you know, we'd have individuals maybe have a job for 6 months, and then they come back to VR for more services. They'd have another job for 6 months, and they come back to VR for services. They'd have another job and come back for 6 months. And I'm, you know, this is, I'm just for the sake of consistency, I'm just saying the 6 month thing. I mean, it might vary by time, but the situation, the scenario is the same. And what happens is, over time, that costs OVR a heck of a lot of money to do that. And again, it's not about the money per se, but it's, you know, there's a lot of resources that are going into helping this individual find these multiple jobs. And by using this model, I think you're helping to eliminate that. It's a little more costly at the beginning, but you're helping to eliminate down the road that revolving door. And again, I know some of these slides are a little repetitive, but based on individual preferences, strengths, and work experiences, not on a pool of jobs that are readily available, and preferences, the job type, hours, types of supports. Actually, I saw recently at McDonald's, and I know I'm saying find what the individual wants, but I thought McDonald's was kind of creating what they're doing. They're saying, hey, you can set your own hours. I thought that's kind of cool that they're doing that. So, you know, I think if a big business is like that, you might have other businesses that say, hey, you know, if this individual can give me quality work while they're working, I'd be willing to set their hours. So again, I think there's ways to be that mediary, to find ways to help businesses be more accommodating for individuals with mental illness, you know, so that when a situation does come together, the individual is successful. And just 8 practices of IPS. Again, I've kind of talked over those. Again, competitive employment, competitive integrated employment. Actually, they should change that to match what WIOA says. Systematic job development. Again, I think that's so important because, as I mentioned some time ago, when Secretary Miller was talking about helping people get out of poverty, we need to help people get out of poverty too in terms of systematic job development. And I think that really aligns with what WIOA is asking of VR and asking the workforce to look at not just getting a job, but a position that helps them grow as a professional. Rapid job search, we talked about that already. Integrated services, I showed you the circle, but again, it's a picture of many people. In regards to, they're all happening at the same time. And that's the critical component, is that they're happening at the same time. The last four, benefits planning. Actually, I just put them in the order that I found them, but I really think that my personal opinion is benefits planning should be first. It should be, hey, if you're interested in working, let's sit down, let's crunch the numbers. You know, again, just like I was talking about buying a house or buying a car, let's crunch the numbers and figure out, you know, is this something you want to do? Zero exclusion. If a person says they want to work, again, as I mentioned, there's some extreme examples where they're bringing in people that have active substance abuse issues. We're not at that point yet. I don't know that I'd be comfortable being at that point. But if a person's even recently out of the hospital and they say they want to work, the team works with them. Time unlimited supports. This is a critical component too in regards to, I mentioned earlier that mental health services are bundled services. So if a person's in an ACT program or an FEP program, which I'll talk more about in a few moments, those services are ongoing. So if a person was in an ACT team or they were in an FEP team, the circle supports, those supports continue on. They don't stop being provided. And worker preferences. So those are the 8, sorry, I'm tripping over the darn wire here. Those are the 8 areas that are part of the fidelity measures. So again, getting back to your question about where can we find this type of supported employment in Pennsylvania. Currently there are 42 assertive community treatment programs in Pennsylvania. There are 9 first episode psychosis programs in Pennsylvania, so a total of 51. Now, they say that they adhere to the IPS model supported employment, but I've been with the agency 7 months now, I have yet to sit down and talk to these agencies and say, are you actually doing the 25 standards? That I don't know. Because again, it's a bundled service, so everything you saw, the circle of services, including supported employment, is all paid for in one fee. So I can't really pull that data out saying, yes, they're following the fidelity model. And I'm thinking that the best way to possibly look at doing the fidelity model is consider making a part of licensing. I know that providers would be very upset in hearing me say that because that means more work possibly for them. But it would be something I would want to negotiate with them to say, in order to have the fidelity of this model, the 25 categories of fidelity, I think it's important that we include this. We evaluate it annually to see how you're doing to make sure that you're increasing your employment outcomes for people. And the Maryland State Mental Health and Vocational Rehabilitation Collaborative, they've been doing this for 20 years. Maryland Mental Health pays for the assessment, pays for the pre-vocational services, and I believe they pay for the second half of the second 45 days of the 90 days that VR has to have for a person to be successful for them to do closure. So it's a very tight-knit program where mental health services are being provided. At the same time, VR services are being provided. So that same individual is getting both services at the same time instead of having to wait, okay, we're getting VR services, we got to wait for closure to happen. Now the services can come in for mental health. No, they're coming alongside each other, and the individual is getting both services simultaneously. So they have again, instead of the traditional supported employment, they have the enhanced supported employment where the mental health services, the clinicians, the whole team is being provided to the individual while they have an open case with VR. So my hope and dream is to possibly be that someday in Pennsylvania. But again, there's a lot of hurdles that I have to go through. But again, having a good relationship with OVR and knowing OVR, I think it's something we can definitely like to have a conversation with them about how could we possibly replicate what's happening in Maryland. But I think too, if we can look at getting managed care organizations or workforce boards to become employment networks, I think that might be a way of covering costs for individuals. Yes, we have a question over here.
Just a resource, a lot of centers for independent living are already employment networks.
Okay. When actually, I spoke to an employment network who's also an administrative network, which I just found out about. They actually train other entities to become employment networks. So I found out about that most recently. But again, I think one of the challenges that Centers for Independent Living, other organizations that are current employment networks have is they're nonprofits, so they don't have the resources up front to do, like, say you need $100,000 to help them get rehabilitated. They don't have those resources, whereas like managed care organizations, workforce boards do have those monies. So I'm hoping we could possibly, and maybe it's a partnership. Maybe the Centers for Independent Living partner with managed care organizations, partner with workforce boards to be that third party to provide the services, but the workforce board, the managed care organization is the funding source to help that case move forward. So again, those are good ideas, so thank you for that. And I apologize, yes, it's one of those killer graphs in PowerPoint. Oops. Sorry. And what we're showing here is it's factors affecting employer attitudes. So again, what we have on the left-hand side of the matrix are factors affecting employer attitudes. So we have disability, previous experience, worker traits, accommodation and costs, personality traits, social skills, reaction to compliance with ADA, vocational supported employment. And then we have the different areas that these are research studies that were done that said what were the factors that were affecting businesses' perspective on hiring persons with disabilities. So from left to right, you have knowledge, skills, and abilities, productivity and costs, employer bias, fear of lawsuits, coworker reactions, customer reactions, and economic incentives. And interestingly enough, it had nothing to do necessarily with anything physical or the person's ability to work, but at the very bottom here, we have the number of research studies showing where were the areas of concern or areas of challenge that professionals had in reaching out to businesses. And employer biases is number one. It's 48 research studies showed that employer biases were the biggest challenge to getting persons with disabilities jobs. So I think, again, the reason I put this in here is that speaks to our need as professionals to be able to make that connection to businesses and say, hey, these individuals have the ability, we know it, we're here to support them. And you're not just getting the individual, but you're getting us as a support system to help your business be better, help that individual be a great employee. So again, it really has a lot about how we present ourselves to those businesses. And then again, another killer slide, I'm sorry. What we have here is annual data by Behavioral Health Managed Care Organization. We call them BIMCOs of year 2017. And what we have are the 5 different behavioral health managed care organizations on the left, and then the different data basically speaking to how many individuals. So just to give you size and scope of mental health versus ODP versus also long-term living, other agencies within DHS that provide services to persons with disabilities. ODP, I think, serves about 55,000, 56,000. I know the number is slowly rising. Also long-term living, I think, serves about 85,000. We serve 660,000. So just to let you know, the size and scope and number of people with mental illness as a disability who were identified as wanting to work. And then the number that I have highlighted here is of that number, that 660,000, 500,000 were not working. So there's a lot of work that I have to do to help my agency, to help service providers, to help MCOs and all those that are involved in providing mental health services to lower this number. as I mentioned at the beginning of the presentation, the Employment First Oversight Commission had indicated that 48 of the 67 counties saw a drop in employment for persons with mental illness. So there's a lot of work to do. And why I'm saying this is just that. There's a lot of work to do. And I think that by getting better tools in the hands of professionals such as yourself, such as the IPS model of supported employment, that's going to be a critical factor in seeing those numbers change. You know, it's getting the right tools in the hands of you, getting the right services to the individuals that are needing these services so that the numbers change here. So we go from 500,000 not working, 965,000 working, to flipping those numbers. So I know it's a big ask, but I'm hoping that you go along with me on this ride. So again, business employer's perspective, we want to get employer buy-in. I think, again, as I mentioned a few moments ago, saying that, hey, we have qualified individuals, not just the individual, but the supports that we provide to you that are going to make it a rocking employment situation. That the individual is going to be successful, you're going to get the services and delivery of skills from this individual that you need. And statistically, individuals with disabilities are more loyal, they call off less, and I think that that's something that's going to resonate with the employer. Role of the employment specialist, again, not just knowing what the individual possesses, but being able to talk about how the services you provide are integral to the success of the individual and of the business, to help the business to be keep their doors open, make their money, provide their services, sell their product, whatever. Role of coworkers, being able to help make that connection, because again, social interaction is a big component of the success of an individual when they're working. Helping the individual, helping their coworkers be able to make that connection to the individual is going to be critical. And the role of the individual, the job seeker, helping them to be mentally prepared for what they need to do their job, and if they need to ask for help, that they ask. You know, again, it's just, I think it's common sense types of stuff, and I'm probably preaching to the choir in regards to what you know about making those connections. Now, I talked about it being a more costly service, and if you look at the third bullet, we'll talk about that in a moment, but it says how you determine how the funding happens. That's something I'm trying to hope to do behind the scenes, is working with counties, working with managed care organizations, working with, that's our funding source within Pennsylvania for mental health services, working with possibly school districts, working with OVR, with other partners in regards to being able to have a blended funding, because that's how it's going to work. Blended funding is the only way it's really going to work. That's the only way it works in other states as well. So again, I'm looking at different avenues through Medicaid, through state voc rehab funds, mental health state contracts and grants. Again, as Ronnie had mentioned, if anyone wants to throw in a grant bid for IPS, I would love that. I'd definitely be, and Ronnie, I'd be more than willing to offer my technical assistance to help you with that. So if folks want to consider doing something like that, great timing. And approximately $5,000 per person in the first year, and typically accrued limited costs thereafter. Now again, when I was working for OVR, one of my roles was to be kind of the point person for supported employment services. And when we had done our study of what it was costing annually, it was about $3,500 a person annually for supported employment for just VR. So again, it's about $1,500 more. But again, when you have partners in there, the cost to OVR might not be any more. It's just the additional cost would be shared by other partners. So again, that's why you have to have those partners for it to be successful, because it is a little more costly, but the benefits are speak volumes. It goes from, like I said, in the 20 percentile to up to 66%, depending on the study. And again, reallocating resources to IPS when feasible, that's what I'm hoping to do is use models that we currently have, like the ACT program, the Assertive Community Treatment Program, the the first episode psychosis program, which have this embedded in them, can we replicate that across other mental health community service providers? And again, what I was hoping to do in our presentation was list the advantages of using evidence-based practice-supported employment for individuals with SMI, reviewed the various methods of supported employment and the benefits to individuals with SMI, such as ACT, such as FVP, the Maryland model, and summarized the benefits of evidence-based practice-supported employment for long-term outcomes. Again, as we had seen in the one slide, as the 8 principles of IPS, the long-term support is integral. It's planned, and how we currently are paying for the services, because they're bundled, those individuals are continuing to get those services in our bundled services through our ACT programs and our FEP programs. Anyone have any questions? Okay, Marianne.
Sorry, excuse me. Thank you. Okay, so in the IPS program, is that limited to 18 and older? Or, for example, to use a phrase from this morning from the keynote speaker, a lot of us have 16 and 17-year-olds who are those NEETs, not in education, employment, or training. So is IPS a possibility for those as well, or do they have to be adult status for these types of programs?
I would say if a school district approached me and said, Randy, we want to do this, we'd figure out a way. Currently what we have is there is a Children's Bureau, which is separate from where I'm at, the Policy and Procedures Bureau, but I'm educating my management to say, hey, you know, employment starts in transition. It doesn't start when they're 21. It doesn't start when they're 25. If we're getting them by age 35, that's too late. So I'm educating my executive team to say, yes, we need to start earlier. And we do have services starting age 14 for youth and young adults. Right. Up to age 26, so that's a different category. So I need to figure out how to bleed into that and figure out how to get into those services and start talking about how we can work with schools, work with BJJS, for example, you know, kids that are in foster care, you know, to be able to get those services to them while they're in transition age. I saw a hand in the back, too.
Is IPS just for people with mental health issues?
I would say that yes and no. The evidence has been done on research for persons with mental illness. I think that it could work for other populations. It could work for kids in the autism spectrum, students in the autism spectrum. I think it would be a very good tool for that. But again, I think part of the challenge would be, though, is if they say they want to do something, you focus on, you shoot in there and get that done. So I think that for certain populations, I think you might have to have some assessment up front just to know what capabilities there are or what capabilities exist. But I could see it theoretically working with other populations if you added that area in there, maybe a little more heavy on the assessment side to say, well, what exactly does this person possess? You know, because they're nonverbal, for example. How do you know? Any other questions? Okay, we have
2 minutes. Out of the unemployment, is it because they don't want to work, or is it because of the businesses don't want to hire?
Say that one more time.
Under the number of unemployment, you have the 500 and 2,000. Is it because the employees don't want to hire, or is it because the people don't want to work?
I'd say it's probably a combination of both. I mean, again, right now, we're just wading into employment and trying to identify what is our situation in terms of what is the baseline. So, again, every county MH office probably has a question. You know, the mental health case managers probably have a question that they ask, do you want to work? And then they just check it off on the assessment tool, the intake tool. So I don't think there's anything refined enough to answer those questions currently. I think it's a question that are you working? Check it off. Are you not working? Check it off. There might not be anything more than that being asked of the individual to get to some more detail.
Because I've been running into a problem where the people I work with want to work, but when I go to the companies that I don't want to work for, they are saying they don't want to because if they need a babysitter, why do they need to work?
Well, and again, that comes back to the reason the IPS team is valuable is because you have those, the employment specialist kind of paving the way to the employer and getting those connections. And I think it's just like anything. You have to develop a relationship. It isn't a once and done kind of thing, but it's like, you know, even if the business doesn't have jobs currently, I think you still need to let them know, hey, here's a service that's being paid by taxpayer dollars that you're paying for, and here's what it is, and explaining that to them. And I always ask folks to go to, I know we're running out of time here, I always ask folks to always, if they can, go to civic-minded organizations like Rotary, Kiwanis, Lions Club, Chamber of Commerce. They're always looking for new people to present to them. And, you know, you're going to get people there that are socially conscious. And I think if you're talking to them and presenting to them and explaining what you provide, that's going to be something that resonates with them. So I think it's doing, you're a scouting party. You know, you're getting out there and you're finding out where the soft points are to be able to, and again, that's what you're selling to the business. It's not just the individual who wants a job, but the services that come with that individual, and you know how it can benefit them to have you as a resource. Does that make sense? Yes. Okay. I think we have time for one last question. The question is, where's the dining hall? I'm sure.
Right.
Okay. Hey, thank you so much, folks. I appreciate
Thanks,
your time.
Randy.
Thank you very much.